side of the joint, synovial membrane. So you are not allowed to force, come on ladies, you are not allowed to force this patient. You are not enemy of the patient. Don't force it. Just see how much you can move. Okay, that's fine. Okay. But if it's far from the area of the joint, okay, you are much affordable, you are much available, you do have much availability to work on the area of the joint or anything else. Okay, it's going to be better for you. Okay, okay, good. So, type of the healing is endochondral bone ossification. You know the characteristic of the endochondral cartilage mediator, you know that, right? You know that. They are telling you, okay, everything is fine. Yes. I have a mediator. What is the mediator here? Come on, what is the mediator? Retouch. What is the mediator
this
here?
Type of healing?
Why you are looking to others? Here, look it this way. What is the mediator? Mediator in the cartilage.
Cartilage.
Cartilage. And it helps much to have much stability. This is, I think, believe me, this is, I think, the 7th time I'm telling you the characteristic of the endochondral. Probably 7th time. Okay, endochondral, you have better stability. Better stability. Got it? You got it? You got it, Yusuf? Better stability. Okay, compare with intramembranosus. Okay, what about circulation? It's very good. It's very good. There are lots of blood here. So, why we need circulation? Because
healing, bone healing.
We need oxygen, we need food, cutting cone.
White YBC.
Osteoblast,
Yes.
within capillary. All of them are related. Good. Okay. What about circulation? Have a look at nice circulation. So, there is a great circulation area over the head of the humerus. Axillary artery, arcuate artery. Are you tired?
Yes.
I'm not. Why you are tired? Why you are tired? It's just 1 hour. Why you are started? You have the chance that the driver came to the hotel so late. You have the chance that. So why you are tired? Let me continue. Come on, bro. How much you talk today? Jack, you were silent before. Okay, ladies, just let me a little move further. Okay, you see the artery, the capillary, everything is fine. There is lots of blood around the head of the humerus, and so there is no need to be worried about any kind of circulation. Where we do worry, head of the humerus, neck of the femur, and lack of circulation, scapula. Okay, good. So, if I'm going to ask you in the exam, and you check the wrong option, this is your fault, not my fault. I told you times by times, probably at least 225 times. Okay, so
لا السؤال الأول من هذا الميديتور مال هاي الإندو شنو معناها الميديتور؟
what is the problem?
ما قال
I think I finally have to learn Arabic instead of you. Finally I speak Arabic. And any question? Do you have any problem? Question, items? What? Nothing. Everything is fine. Perfect. Any question with you? Group of 3. Group of 3. Or 4. Noor as well. Group of 4. Or 5. Okay. Any question, bro? Any question? Okay. Where is the other bro? She has some. Okay, expected time for healing 6 to 8 weeks. And expected time for rehab for your treatment 12 to 52. Half a year. Or year. A year. 52 weeks. So, you may confront with a problem, you may continue the treatment up to the time. But the lowest amount is 12 weeks. That means 3 months. 3 months. You are involving with the patient of upper and humerus fracture at least 3 months. Okay. So, purpose of medical, I will repeat it more than 100 times during this course. Purpose of medical treatment? Have a look. Stability, alignment, keeping alignment. Okay. Purpose of physio, I will ask you in exam. Purpose of physio, I will repeat it more than 100 times. When I will ask you probably in the clinical internship or next semester, no need to think about that. You will repeat it at more than 100 times, any of the fractures. Purpose of the physio, pain, function. Function can be ROM, power, dexterity, coordination, anything else. Okay, pain, ROM, and function. Okay, and what is the humerus? I must use actually the PDF, it can be better compared to the slide, right? Next time I will prepare PDF. Okay, we want to talk about upper end fracture, upper humerus end, and part of the scapula. So we are reviewing the physical therapy treatment or upper end humerus or scapula. Clear? Okay, so this is a week 1. You have this slide. You have this slide in front of yourself. Okay, it might be a little compressed. Next time I will bring the PDF for you. Okay, in the first week, 1 day to first week, avoid any movement in the shoulder. In the first week, you can't do any movement in the shoulder. Why? In initial step, you need immobilization, stability. If you don't consider it, what is happening? Return again.
Fracture.
Inflammation. Return again. You may not have a refracture, but you will have a kind of inflammation. Again, everything going to be a start from the initial step. So you lose the time. Clear, easy, piece of cake. Piece of cake. Okay, so is it possible to provide any kind of movement, any kind of active, assistive, progressive resistive exercise, PRE, progressive resistive exercise, with resistance in the shoulder? Not at all. There is no movement in the shoulder. So, in shoulder we do have 2 muscles which does act on 2 joints.
Yes.
The biceps, the triceps. Okay, so I can do for instance, extension in elbow, but provide a kind of tension in shoulder.
Ahead of biceps.
Yes, because this is a kind of total muscle. You know that. You know the knowledge of anatomy, origin, insertion, anything, especially for musculoskeletal system in physio, it must be much more compared to a physician. Tabarak is higher Yeah, it's tired. It's okay. I know it's a little hard. Yeah, I'm not talking in your mother tongue, but you choose to be in an environment. I hope you choose. I'm not sure. Probably you forced to choose, but you are trying to be in an environment, international environment. It's a kind of high actually option, high good quality option. Going to be helpful for your next steps of your life future. Okay, any case, anyhow. So, when we are trying to provide something like movement in the elbow, for instance, okay, we must be considerate about the other part of the muscles. So, how can I keep it? How can I be confident? If I want to do something like flexion extension, which movement can create a lower amount of the tension? Middle range or the final range?
Fine.
Middle range. Thanks, Mary. Middle range. So you will start middle range. Don't force it to the final range. It will be the next stage. Okay, I'm talking about the other joint, not the main joint. I'm talking about the other joint. Okay, and if you are heading to do something in elbow, okay, if you want to plan to do something in elbow, okay, you want to be confident that there is no problem, there is no movement here, so you can keep it. Keep it and ask the patient, okay, provide your hand in this way. You cannot explain for the person, for a patient, worse in illiterate patient, you know my meaning, the person who cannot understand you. You cannot say that, okay, please provide or move your hand in a middle range. Show it to the patient. Just keep it. Please move your hand in this way, exactly like me. Exactly like me. Okay, so gonna be shorter, no losing time, and you can move faster. Okay. So function, he will be in trouble for food, for brushing, for button closing. He will be in trouble. He needs help. You must provide a kind of instruction for the family. Okay, he will be in help. He needs help for a while. Up to when? Up to the time which I'm telling you. So, right now, you must help him or her. Okay? So, weight bearing, is it possible to get a kind of 10 kilogram? Is it possible?
No.
So, you want to kill the patient? It's not possible. Non-weight bearing. Okay, very good. Hemi-arthroplasty, that means actually bringing something artificial instead of head of the humerus. Hemi-arthroplasty, you have in your actually slide. Okay, for the second and third week, what is the worst direction, worst movement you can do that? Worst movement. The mechanism of...
Isometric.
No, worst, I'm talking about the movement. The
Extension.
mechanism of refracture, redislocation, what is that?
Extension. Internal
And-
rotation.
External rotation. So this is the worst action. So you want to try for that at the last stage, not now. Somehow it's going to be different for some part else. So,
External or internal?
For shoulder
Let's start internal.
extension, abduction, external rotation is the worst movement. So try for that in the last step. So you can see, avoid external extension and internal rotation and abduction, external rotation. Okay, you are at the weeks of 2 and 3. Among different type of the treatment, the muscle contraction, isometric, concentric, eccentric, isokinetic. Which one is initial? Isometric. Then concentric and eccentric. Which one? Concentric. Then eccentric. gradually. And you still need the kind of dressing, help to dressing, nourish, clean, anything else, and still long way. Heading to the fourth phase. What was the time of the third cortical bridging? 18 to 21 days, 3 weeks. So, if everything gonna be okay, if you have a simple fracture, not compound fracture, and if the stability is good, after 3 weeks you are in a good stage. You will be much freer to do. Third cortical bridging, you do remember? This is the key term for any kind of fracture. Third cortical bridging. You know the meaning of bridge? Come on. Bridge, pole.
جسر.
Bridge.
Yes,
Yes,
we know.
okay. So, we have first cortical bridging. Do you know the meaning of cortex as well? Cortex is part of the bone,
Yes.
around bone. So, okay. We have 1, 2, second, third, fourth. When you reach third cortical bridging, you are much free to move faster with provide any kind, because you are confident about stability. Third cortical bridging means a stability. How you can understand this is the third or second in radiology course. Okay, but you are looking for third cortical bridging. And the last point, last but not least, you must know that for third cortical bridging, you need a time at least 18 to 21 days if everything gonna be okay. Okay, can we move it a little faster, sooner or later? Yes, we can, but not too much. We cannot reach third cortical bridging at day 2 after fracture, 3. We have to keep it, but probably he is an athlete person, probably there are much power, probably you can move with some intervention of physio, but it reached probably to 15 days, 1-5, 1-6, 1-4, not earlier than that. You cannot jump, you cannot reach it earlier. It's very, very rare, it's very seldom. It's not happen, it's not common. Mostly you must be ready for the 18, 1-8 up to 21, 3 weeks for third cortical bridging. Okay, so everything is fine. You can work with different muscle, somewhere like here or here. You can do anything with your lower extremity. But when you are focused on the upper extremity, you can work with the forearm, with the hands, fingers. It's okay. At the week 4, you can reach to the area starting with isokinetic, starting with isometric, then concentric, then eccentric, but there is a limitation. You are always must be considered that which movement going to be a danger for the patients. For the shoulder, it's abduction, external rotation. So this is the last movement you reach it. Here is abduction, external rotation, because it's most common method of fracture or dislocation for shoulder. Might be different in hip, some other actually direction. For each actual joint, you have some specific movement. This mechanism of injury. Okay, function. Imagine, have a seat, have a look. It's a little lower. So everything gonna be better after 4 weeks. There is a seal, a kind of need for kind of help, for the nourish, for cleaning, dressing, something like that. But it's gonna be a little better compared to the past. WBAT, weight bearing as tolerated. It can take some items. Weight bearing as tolerated, or half a kilo at most. And see, 6 to 8 weeks, 2 months. Everything gonna be better. For the muscle and power, isometric, very small, don't need it. You reach to isotonic, stretching. You are completely confident that the bridging is complete, it's healed. So we are trying to do isometric strengthening exercise, or needs help for the nourish or dressing, it's very small. Probably he's independent at the 2 months. Probably he's independent, but if it's not, he's still have time up to the 3rd month. Remember, we need 3 months for upper end fracture. Okay, weight bearing as tolerated, everything is fine. Avoid high force. When you are looking for a kind of high professionality athlete job, you have a weightlifter. He cannot do that before your actually evaluation. He must complete everything, every part of the treatment, and then you must protect his joint by some extra conservative treatment. How? You must empower the muscle. How? Which kind of contraction can help you? Concentric, eccentric, and then isokinetic. He's a weightlifter. He must work with the isokinetic. I'm talking about a professional athlete, not a normal person. Professional athlete. He needs higher power. Okay, everything is passed. Right now, finally we reach the 2nd to 3rd months. So is there any limitation? Probably not. Probably not. So everything will be okay. We are having moved. We are at the end stage. So which kind of exercises we can provide? High tension exercise, eccentric, concentric, complex, PNF, D1, D2. Do you remember D1, D2?
Yes.
Okay. Okay, you can provide. Can you provide resistance? Yes, why not? Want to increase the power? Okay. So is it necessary to use the isokinetic? Possible at the end stage, not now. End stage of the treatment, probably close to 12 months, close to 3 months, 12 weeks. And if it's necessary, it's not necessary to use isokinetic for an old guy, 75 years old. Why do you want to use it? He is not a high athletic profession. Why you don't need it? Put it on the isokinetic device. You cannot provide isokinetic contraction in an environment in earth. You need a kind of device, isokinetic machine. You need a kind of isokinetic machine, such as they are based on the company name, King Kong, Biodex, isokinetic. You can't provide any kind of movement. You have it in the pool. You remember this is isokinetic. Okay, it's easy. It's kind of movement, and when you push the water much firmly, you have much stronger resistance. It's kind of isokinetic. Okay, you can't have it in the air, in the space, in the earth. Function, you can see that needs help for. Can you? You can't see that. You can see it with a kind of microscope, something like that. Don't need it. He will be free, no limitation. Okay. Weight bearing, full weight. At the end, reach the full weight. And everything gonna be gradually. There is no jump. There is no jump. And based on your sign and symptom, you got it to the patient, and based on your evaluation. There is no exact frame and do the same for all people from young age 12, 13 up to old age 80. It's not possible to complex them. It's based on your evaluation. Good job. Good job. I think you deserve to have a rest.
Okay.
Okay.